Everyone, welcome to the session. Um, Today, as mentioned, we'll look at analysis of the P data, and looking at also integration reporting of the mixed methods data for the process evaluation. In terms of the overview, I'll cover a bit of the analysis and interpretation of the mixed methods data. Ung will go through the case study from Interact 3, and then she'll do a recap of the first 3 sessions that we've done till now. And hopefully we'll have enough time for a discussion about your experiences with mixed methods analysis as well. So going back to mixed methods design analysis, in the first 3 sessions, we talked about the MRC kind of research cycle, again, around feasibility, evaluation, implementation, and the intervention. And I guess I bring this up again because it does relate back to the use of mixed methods and whether you're using, for example, sequential exploratory, which often is more around that feasibility because you're still exploring, things that you don't know and want to find out, or at that evaluation phase where you're trying to explain some of the results from your study. So in terms of mixed methods, I'm personally not a quant person, but I've learned a bit more, and often we work together in bigger teams with other people. But of course, as we know, and especially those who are confident in this space, there are descriptive analysis statistics, which will include your basics of mean, median, variance, standard deviation. And it's important when you look at that for the implementation outcomes to describe that of reach and adoption, for example. And then there's more kind of sophisticated ways of looking at inferential statistics of hypothesis testing, correlation, regression analysis. And for some of the work that we've done, that can be helpful when you're looking at the for whom. So for whom does this work? You're wanting to look at some of the variables to say that's the cohort, for example, that this intervention has an impact on. And of course, for those more complex kind of contextual settings and interventions where it's harder to do RCT, you've got things like time series or predictive analysis, and I think more relevant to environmental health. And then, of course, you look at different variants. So this is just, again, just a snapshot, say that there are lots of different kind of analysis that you can do for quant, but it's important to have that expertise in it, but also to have that rigor in reporting across these different analysis. In terms of qualitative analysis, I know most of you have done the qualitative analysis course, but in process evaluation, for myself, kind of self-taught along the way through the different courses, was we often do thematic analysis where you've got those different stages of familiarizing yourself with the data, of the interviews, generating codes, which is that kind of close label of the data, collating the codes into themes, and then defining and naming the themes in health research. You can also have narrative analysis of that interpretive approach of phenomenology, where you're doing case studies and doing a lot more in-depth description of each and a lot more along social sciences. Just a quick word about inductive and deductive coding. We know that inductive coding often like data-driven, flexible, is exploratory. So for those who are using, for example, sequential exploratory, it's more likely that you do a lot more inductive coding. Whereas deductive coding is theory-driven. So you've got a hypothesis in mind, you've got certain themes that you're looking for, and you're trying to confirm that. So it's that more framework analysis in your coding as well. And it's best for kind of testing your hypothesis. So I bring this as as you think through your mixed methods, whether you're doing convergent or whether you're doing exploratory or explanatory, the type of coding you do will different. Often you do both, but the focus, I guess, and emphasis on the coding will be different. Mixed methods is complex, and I'm still learning my way. We are, I think, through this. And I put this figure here because this is from the mixed methods appraisal tool. And again, it's just highlighting when we think about research, yes, you've got a qualitative study design, in which, each of these lines will have its own textbooks of case study, ethnography, grounded theory, interpretive description, narrative research from knowledge and qualitative description. But it's important in your process evaluation team that you've got people who are comfortable and know, qualitative research and how to do that. For the mixed methods, we talked about it last week about convergent design, where you're collecting both at the same time and bring that data together. Sequential, depending on the time frame of using quant to then use the qual to explain the quant, or whether you're using the quant to then further explore other areas in the area of topic. But importantly, you know, depending on your research cycle, whether you're feasibility or evaluation, implementation, you can also have different kind of quantitative design. So if there's intervention exposure, more than one group, then random allocation, you've got your RCTs before and after, and then observational study as well. And again, this just to highlight the complexities of, you know, when we say mixed methods, we have to think through the qual and the quant and the appropriate study design and rigor in both areas, and then also think through about how are you actually going to integrate the data from both qual and quant. This is the LMAT checklist. It's often used for systematic reviews of mixed method studies, but I think it's very helpful as we go through, you know, as you start designing a protocol and think through your study, that you are meeting that methodological criteria. So qualitatively, the 5 criteria there is for those who are doing RCTs, you know, your randomization itself and your groups. The non-randomized, are they representative of the target population, things like that. And then descriptive, what's your sampling strategy, for example. And mixed methods specifically, the 5 criteria here. What's your rationale for using the mixed method? So think through for your process evaluation, how you describe that, what your different components are, how are they effectively integrated, and are your outputs of your qualitative and quantitative components adequately interpreted. So you're not just reporting back, I found X and Y, but I found X and Y, and what does that mean in the situation? If there's any divergence, whether that is explained and do the differences make sense? You know, can you tell that coherent story? And if not, what are some of the limitations? So a little bit about integration at the interpretation and reporting. You're really combining that quantitative and qualitative where they connect in that mixed methods design. And there's that synergy that you can get from integrating the 2 strands. So this is, this table is from one of the pre-readings about how you can have convergent, explanatory, sequential, and the integration intent can be matching or building and the timing of it. So for example, for here, they're saying when you're merging, so you've collected your quant and your qual data, and can you actually ensure that integration can occur readily? So in the process evaluation, for example, you might have done in my experiences in clinical trials, you might have done the RCT alongside and you've done the interviews, and then you're trying to use the process evaluation framework to integrate and merge those results. And so having that intent of how you would actually do that. So for example, reach, you might be thinking of reach and you're collecting the data of quantitative data for reach, but you're also asking the questions of how did you recruit your participants, etc., and that matches that integration content. In looking up mixed methods, I actually did a presentation, or I've met Dr. Michael Fedders. I don't know for those who know mixed methods, but more Michael Fedders and Cresswell really led mixed methods research at University of Michigan, and a lot of that wording around mixed methods research and the advancement. And I guess just highlighting and a tribute that he has passed away a couple of years ago, but that's a tribute to his life and his legacy for mixed methods research, and we continue to build on that in our work. This is actually a link, but he was, when I first met him, I think he was always saying mixed methods is a bit like 1 + 1 = 3, where, you know, individually they're ones, but when you pull that mixed methods and integrate and analyze, you come up with more, you know, equals 3. It's that wealth and that depth of that insight, as we know. So quantitatively can tell a story, but plus those stories from the ground collectively just tells a lot more in depth. And I hope in our research, that's what we can do. An example of what we've done for mixed methods study. So this was a work done by Ethu, who was a PhD student with Professor Bruce Neal, looking at salt substitute in rural China. So we had a trial where we looked at salt substitutes in patients and families with stroke, and then looked at the outcomes. This was the process evaluation, or the kind of mixed methods evaluation alongside it. And so we were trying to look at the families' perspectives of the use of salt substitute in rural China. So it's a sequential mixed method study of salt substitutes. This figure here shows that quantitatively what we did was we did surveys. So we were looking at knowledge, attitude, and practice of the use of salt substitutes, and they collected the survey data across these participants. And there was 1,000 participants, so a lot, you know, a big kind of data. And then using that, we could then connect, and we said, well, we want to find out in which areas was there low uptake of these salt substitutes, low use of the salt. And then we purposely sampled the participants there to get their perspectives of that. And going back to theoretical frameworks, this is one of the ones where we thought using the COM-B, so capability, opportunity, motivation, behavior model, would be helpful in terms of the interview guide, but also the analysis of the data. And we only interviewed 30. And as we know, that's the difference in the sampling, but together they can tell a nicer, more in-depth, meaningful story. The integration, what we did was we used a joint display of the findings to compare the results from the survey and the qualitative data across those domains of the COM-B domain and the barriers and facilitators. So if you look at the table on the right, you can see that capability, through the survey was looking at, well, what was the percentage of people who said they were trying to reduce their salt intake? That was like 82%. And then in the actual interviews, when we interviewed them, they said, oh, yes, because we predominantly use home cooking, we can use a salt substitute. However, at the same time, there was also reporting through the qualitative findings that there was actually a lack of awareness of what the recommended daily salt intake was. So while they could use salt substitute, they actually weren't quite sure what the level is. So the meta-inference, where you now equals 3, try to bring those two together, is that, while both the survey and the interviews demonstrated that reduced salt intake and home cooking confirmed the capability, so that COM-B domain of salt reduction, but actually found there was a lack of knowledge will become a barrier to actual sodium reduction in the long term, because there's a lack of kind of understanding of what that recommended level is. And similarly went through that for opportunity and went through that for motivation. This is some of the wording that if you read the mixed methods meta-inference, you can look at the wording of, expansion versus confirmation and diversion. Then you try to explain that. And that, again, is that analysis, more in-depth analysis, where using quant and qual to kind of confirm, expand on a concept, or if it's divergent, well, why is that? And then try to find out a bit more. And so it creates that scaffolding for analysis systematically, without just saying this is the result, and having to actually combine and make sense of those findings. Another type of integration, I guess you could think of it as data transformation, where you convert data from one form to another. So quantitizing, you can transform qualitative data, such as interview transcripts, into numerical codes or categories for statistical analysis. So for example, when we did coding, you might have a lot of people who all say we like salt substitutes. And then you can still say, well, out of the 30, we had 80% of those who actually like. So that's, you're using qual to quantizing it. Another way where I've done it before is in the family-led rehabilitation trial, we had open text descriptions of what action was taken. So let's say, putting a spoon, that was their rehab move, or dressing or something like that. And using those open text to then say, well, what was the goal? What were some examples of goal-orientated actions? And then you can group them and transform that qualitative open text data into categories. So that data transformation, for example, is another kind of example of integrating qual and quant. And then qualitizing is when you have survey responses and you then pull them into narrative descriptions or themes, just like what we did for capability. So you can say 80% new to use a salt substitute, and that becomes a narrative description. This here is just from another study where we're looking at medication, not us, external paper, but a medication communication index. So again, you have interactions between providers and patients, and then you're looking at the discussion, and through the analysis, you've now come up with certain categories, and that becomes that data transformation as well. Another level of integration could be narrative integration, where I think that's probably what we do in how we report things. So you have a single report to describe the qual and the quant results. That's, for example, on the right, where you've got quantitatively, how old are older drivers? Qualitatively, what do they say protective measures are? Then you compare and integrate them, and then you have, the findings describe this, and then you have the discussion. So consistent with the literature, history, etc. So that is where you use both and then compare. You can also weave, where you present both findings together and then you interlace them theme by theme or concept by concept. So for process evaluations, where, for example, if you're looking at reach and acceptability, that can be your overall concept, and then you're weaving your qual and quant findings across it. Another way of presenting it is contiguous integration. So you can have qualitative and quantitative findings, but into distinct sections. So survey, for example, we did a pilot feasibility trial, but we also did a process evaluation. In that one, we did very much this is the findings of the pilot RCT. Here's the tables, and then we went through the qualitative findings. So into distinct sections in terms of how you present it, integrate it. And lastly, a stage approach where each stage is just reported sequentially as a data and analyzed and published separately. So like in Interact 3, you publish the RCT first, and then we had the PE findings at the vanguard phase, but also at the kind of overall study phase as well. So that kind of staged approach where presented separately, but really overall study is integrated. So that was a very kind of high-level, quick overview of some of the data integration, and really went quite quickly through quant and qual, but that's just to highlight the different areas and the rigor that's necessary. And some personal reflections, I guess, from different projects, that often we have this thinking that process evaluation is just qualitative research, but it isn't. I think it often, as we move into mixed methods research, it's really interdisciplinary. And so you really have to have a team who respects that and is able to conduct those type of analysis. For the rigorous mixed methods research and impact, bearing in mind, of course, I think when we went through it last week, but the different paradigm between qualitative research, where the interviewee has all the knowledge and is the expert in it, versus qualitative, where that, epidemiological data and the researcher is the expert of all this data. So those different paradigms and respecting that. Second, that's really an opportunity to strengthen data collection systems. So for example, you can use some of your qual to inform new development of patient-reported measures, or validate it, or culturally adapt it to your local context. You can also look at contextual things that say level of stroke units by the World Stroke Organization. Is it a basic one? Is it an advanced stroke unit? And you can use that data collection system to inform your context. So when you're doing your evaluation, as you develop your data collection for it, it'll be great if that's something that can be embedded and simplified into the normal system for sustainable health system change. The third point is there's often too much. Sometimes we finish and we go, oh my God, we've got so much data, so much open text in the surveys, too much to analyze. So just be mindful of your timelines, be mindful of your budget and your feasibility and what's possible. Be mindful of how it might impact people on the ground collecting the data as well. So what is it that you are really interested in? What are some data points that you can capture? How can you do that efficiently? And then lastly, that the mixed methods research itself is an iterative cycle of continuous improvement, because yes, you can have convergent, but at the end of the day, whatever you find from that could potentially be exploratory or explanatory, that it enables that continuous improvement in the research that we do. And I think that was, on that note, I will hand over to Meng Lu.
To share the interactive study as an example on how did we, should be going back, did analysis, mixed methods analysis for, for Interact 3 using a mixed methods. So I think probably all of you get much more familiar with Interact 3 because we're talking through it all the time in the different session, and introduce like the methods and process. How did we conduct the process evaluation within this large international cluster randomized trial? So in the last session, I introduced, we collected both quantitative and also qualitative data, which include survey questionnaires and also interviews, focus group discussions. So for the quantitative data, we collected like in the whole study life cycle. So we collected a survey and questionnaire at the baseline and also at the end of the study. And we use a descriptive analysis, which reported, like, for example, the numbers of the participants, and also like what is the percentage of each of the sites characteristics, such as like whether they are tertiary hospital or how many of them participate through the neurological department or emergency department. And also for the qualitative data, it's mainly from the interview and focus group discussion. So as mentioned before, for Interact 3, it has a Vanguard phase and also rollout outside of China after the Vanguard phase. So we had an initial thematic codebook, which is built up from the Vanguard phase. So actually in the Vanguard phase, the coding method we used is much more inductive because it's like from all the start of the beginning. But then after we roll out it in the like the other countries, the coding is much more like a deductive because we already have an initial code book and we just build up the themes and also to check across whether there is any difference or new themes coming out from a different countries under different context or health systems. And also the goal is actually to reach the thematic saturation. And we used NVivo as software to manage the data and also to manage the coding we did. To better integration the qualitative and quantitative data, we used joint display as like to merge and matching the results we got from both of the data type and trying to visualize it through the side-by-side table and figures. So this is an example of the joint display that we had in the process evaluation in Interact 3. So as you can say, we have a same or similar question regarding one topic. For example, we want to know the barrier of the intensive blood pressure lowering as one component of the Interact 3 intervention. So we had some knowledge about what the barriers from the focus group discussion. So we developed the quality control survey based on the options that related to barriers and collected the survey in a group of the physicians and nurses, but also want to know much more detailed about the barriers actually to reach the target of the blood pressure lowering. So we have this specific question in the interview. And after we collect the data and did analysis, we actually can match both of the results from the survey and interview. And we use a bar chart, which presents the findings from the survey, which can show like which is the most mentioned barriers for the blood pressure lowering, but also as some quote, which is from the interviews to explain more about why it is a barrier and how it impact on to reach the target of the blood pressure. So this is what just like, I think one approach to use the joint display to better integrate all the data that can be explained for to reach the to explain the research question that we have in the process evaluation. So this is just a brief introduction of the Interact 3 process evaluation. And if you are more interested, you can go back to the reference list that we shared before. There are more examples on how we did for the joint display. So just a recap in probably 5 minutes about the previous sessions of the mixed methods research for process evaluation, because we're going to develop your own protocol for the process evaluation. So the first step would be establish the research question and also to understand and define like what kind of approach are you going to use to answer your research question. It also you should be consider about the implementation outcomes you're going to measure, to trying to explain your process evaluation, or to understand the quality of your implementation. And also it will help you to better find or choose the right frameworks, theories, or models that help you to understand what is the theory of change. After you develop the question and also the design, then you will have a better idea about what kind of mixed methods design and also what are the data you're going to collect to answer your research question for the process evaluation. So probably you still remember from last session, there are a few different types of design. It can be exploratory sequential or explanatory sequential, or it can be parallel convergence analysis at the same time. And for the data collection, qualitative, it can be anything like interviews, focus group discussion, or something like observations. For the quantitative data, it can be a questionnaire, survey, or other like data you collected through your main study or main trial. And then the last one, the next step is about to analyze your data. So as mentioned, you can analyze the quantitative and the qualitative data separately. And for the quantitative, you can just use a descriptive analysis to describe the characteristics of the participants and also to describe the findings. For the qualitative data, it's mainly on the semantic codings, and there are different type of coding, and inductive or deductive, depending on your design and also the questions that you're going to answer. And for the mixed methods data, you will have some strategies to integrate them all together to better explain and visualize the data. It can be emerging, like matching what we did in Interact 3, or you can connecting them all together to trying to explain each of other, or you can building them all together. So I think the figure in the slides, it's really helpful to understand like at each of the process, like what you can use for the qualitative or quantitative data to actually analyze. And also to at different time of points, what can be better used to for you to understand the process and also the quality of the implementation, as well as to further reflect and guide you to improve the study design or to improve the intervention. So I think now that's the end of the training session for this, for the data analysis and also integration.